Welcome to Flora Aesthetics and Wellness. I'm nurse practitioner Carly Corse and one of the providers here at Flora. We are so excited to have you join us for our first ever webinar, our Sofwave virtual event. Be sure to stay until the end of the presentation for a live Q&A. You'll be able to submit your questions via the questions tab and have them answered by our team live. Because we know you'll ask, all the questions are going to be anonymous, so feel free to ask whatever is on your mind. It's likely on someone else's mind too. We're going to be raffling off some exciting prizes to attendees of tonight's live event, and we'll notify the winners via email in the coming days. Because we know you'll ask, we also are going to be offering a special Sofwave promotion in honor of this event. It's going to be valid for 1 week from tonight, so it expires at the end of the day on February 6th. For the promotion, you're going to receive a full face and neck Sofwave treatment and a booster treatment in 8 to 10 weeks for $2,999. That's normally $4,600. Additionally, if you join our membership program, we can tell you more about that later, you'll receive a complimentary Prep and Enhance kit. That's normally $289 to make sure that your skin is properly prepared for optimal results. And you're going to get an Erbium laser add-on to one of your 2 Sofwave treatments. That's an $800 value, and that's going to help clean up the surface of your skin, so help get rid of some of those fine lines and sunspots. Keep in mind, we do offer financing through Cherry, so that's something we can share details with you about after the event via text or call. But let us know if you have any other questions. Sofwave is a non-invasive advanced aesthetic treatment designed to address skin aging concerns, particularly focusing on skin tightening and wrinkle reduction. The science behind Sofwave utilizes special technology to target specific layers of the skin. In short, it impacts the stuff we want to impact and doesn't harm the stuff we don't. We chose to bring Sofwave to Flora for its effectiveness in delivering noticeable results with a non-invasive approach. Plus, we love that there is no downtime or sun sensitivity, making it something that can be done any time of year, which is important to those of us who love to be outdoors in beautiful Southern California. We're often asked how Sofwave is different from other treatments on the market. In short, we just don't think there's anything that compares. There's nothing that has the same efficacy, safety, and patient satisfaction when it comes to skin tightening and wrinkle reduction. Surgery can certainly do this, but it has notable downtime and it has what I like to call a different look. We love Sofwave for its natural results. We did look into Ultherapy when researching devices at Flora and ultimately decided against it as it seems to have more variable results, higher pain, and lower patient satisfaction. We attribute this to Sofwave's ability to precisely target the dermis and the SMAS layers of the face without targeting deeper structures that can cause more pain or cause unwanted aesthetic changes. So who's the best candidate for Sofwave? We think the best candidates are patients with mild to moderate skin aging and loose skin. This is typically going to be patients in their 40s to 60s, but we also love it for patients in their 30s who have maybe had more sun exposure and have more laxity or who want preventative care, and for patients in their later decades of life looking for a non-invasive way to rejuvenate. Many of our patients who choose Sofwave note that they did so because of its non-invasive nature that fits into their busy lifestyle where they can't really have downtime. We'd like to note, our unofficial answer is that pretty much everyone is a good candidate for Sofwave. It really is amazing. It works well on all skin types, all colors, and all ages. Believe it or not, Sofwave has no downtime. Like, actually none. The only caveat to this is when patients elect to use injectable numbing, as this can sometimes result in bruising, but that's typically really easily covered up with makeup. As far as when you're going to expect to see results, we inform patients not to expect results for 4 to 6 months after treatment, but we often are hearing from patients in the immediate few weeks following their procedure that they're noticing a change in the overall feel and tightness of their skin. While it's not required for good results with Sofwave, we love doing a booster treatment at the 8 to 10 week mark, as it's the perfect window to capitalize on that new collagen that was developed with the first treatment, and we consider it doubling down to achieve optimal results. So we're here today, we're going to consult on Sofwave.
Okay.
And I know you already have an idea of what it is, but we're going to kind of talk through all of it so that I'm sure that you understand what we're doing.
Okay.
But let's talk about first, we have your photos here in front of us. Tell me about what you're looking to see in improvement on your face.
The biggest changes I've seen recently is the fine lines, especially around my upper lip, the jowling, under the eye area.
Right.
That just...
And problems that everyone talks about as
Yeah.
we get older. You know, gravity takes its toll. We start seeing our volume shift.
Mhm.
A lot of the times it's not volume loss, but it's volume shift that's moving down.
Gravity.
And then we start seeing a lot of fine lines because we're expressive, happy people. And so we see lots of lines and some laxity of the skin that starts. So, you know, like my son, when I pull his face, there's nothing comes out, but for us,
Hello.
we get a lot of pull. So for you, what I'm seeing and what my goals would be for you for Sofwave is really hitting on the submentum and along the jawline to help give you that lift.
Uh-huh.
And then also hitting the fine lines of your smile lines around your eyes. Now you have bangs. We're not hyperfixated on lifting your brow up, but that is something that we can do with
the left eye
Sofwave.
more than even the right eye, because the left eye feels droopier to me.
Okay. And so that's part of what we'll do with your treatment planning and taking your photos is kind of measuring and seeing what areas we want to focus our pulses in or not pulse in.
Okay.
Neck for sure too.
Yes.
We want to pull up that neck and kind of help give some of that collagen and elastin back.
Okay.
So for a Sofwave treatment, we're talking about it now. We're going to take all of your complete photos here in a few minutes and then start your numbing.
Okay.
We have two options. You can do topical numbing, which we numb you for about 45 minutes with topical cream on your face. That works very well at numbing the vast majority of your face.
Okay.
We also offer injectable numbing. Injectable numbing works much faster and it's more effective, but you risk having downtime because it's a needle.
Okay.
So you can have bruising. Most of our patients elect just to do the topical, and then sometimes we'll do injectable numbing just for the forehead and around the eyes, because that tends to be the more tender area. You'll find with Sofwave, it's the most uncomfortable in the areas that are over bone. So forehead, we're right on bone, right around the eye, when we have our eye socket, you're gonna feel it's a little bit more tender along the cheekbone, along the jawline.
Okay.
The other areas, because there's more soft tissue there, it's not as uncomfortable.
Okay.
So I think for you and knowing you as a patient, I would do the topical numbing, and if you feel like when we do the forehead that you want the injectable, we can do that at the last second.
All right.
But depending on our patients and what their pain tolerance is like, sometimes we do the injectable from the get-go.
Okay.
You won't look, unless we do the injectable and you get a little bit of bruising from that, you won't have any kind of downtime. So you're gonna leave looking like you do now, probably a little bit pink, just from being flushed from having us touch your face.
Sure.
And you will look normal tomorrow. There's no change in your skincare regimen. There's no change in your activity. Nothing else changes.
So tomorrow, more makeup as usual.
Normal makeup. If you want to go work out in the morning, all of the things are normal. Thank you so much for attending our virtual Sofwave event. Please feel free to reach out with any questions about Sofwave or any of your other aesthetic needs and goals. We will be drawing winners from a raffle in the next few days, so keep an eye out for emails or texts from us notifying the winners. And be sure to text your text after the event and reply back to book an appointment. Now give us all your questions. Remember, no question is dumb if you're thinking it, someone else is too.